Measles on the march. It is now in 14 states and has health officials in Arizona on high alert. They are trying to track down anyone who may have been exposed to the virus before the Super Bowl on Sunday. Hello everyone, I'm Elizabeth Herr in New York, and some of the blame is being put on the parents who refuse to vaccinate their children. Let's get the very latest from ABC's Marcy Gonzalez.
Concern growing across the country. With more than 80 cases of measles across more than a dozen states, health officials warn this is a critical point in this outbreak.
A big thing with measles is that it's extremely contagious.
Experts believe this outbreak began last month after an unvaccinated family was infected at Disneyland. Then a woman exposed to them contracted it. And because measles is spread through the air, doctors worry she may have exposed nearly 200 children to the virus when she visited a clinic near Phoenix. Health officials say 1,000 adults in the area are also being monitored.
What they're being told is to watch for signs and symptoms of measles.
And with Super Bowl fans heading to the big game in Phoenix this weekend, medical students will be out looking for anyone with measles-like symptoms, which include fever, cough, runny nose, pink eye, and rash. This outbreak is reigniting the debate over vaccinations and the choice more parents are making to not immunize their children.
There's also many risks if they get the vaccine versus getting an illness that they could actually recover from.
It's a personal decision, I understand, but you have to look at the greater good as well.
And now in Phoenix and across the country, doctors are telling anyone potentially exposed to the virus and not vaccinated to stay away from public places for 21 days. Marcy Gonzalez, ABC News, New York.
And let's bring in ABC News Chief Health and Medical Editor, Dr. Richard Besser. Thank you so much for joining us. And, let's talk about Super Bowl. I mean, that's all the buzz right now, and Arizona being one of the affected states. How concerned should we be about the spread?
Yeah, I mean, I can understand why people are concerned. You have all of these thousands of people coming together for this event, but the risk is really incredibly low for people attending the Super Bowl for a number of reasons. The first is, we have 84 cases of measles across the country. That's across the entire country. In Arizona, there have been 7 cases, but most of them were in one family. So the likelihood of someone going to the Super Bowl and running into someone who has measles is very, very small. When you have measles, you really feel terrible. So I doubt that someone who's sick, who has one of those precious Super Bowl tickets, is even going to make the trudge over to that game to watch it. And if you're attending the game, if you were born before 1957, you're immune. You had measles, you don't have to worry about that. And if you got your vaccine, you're protected. So those going to the game, I think, can relax.
And you've been quite active on Twitter. I'm sure you've been answering a lot of questions. Let's actually read some of the tweets that you have received. First, from Rick Lerner. Both of my kids were immunized when they were young. They are both in their 20s now. Are they at risk?
So if they were fully vaccinated when they were young, they're protected. We now give children 2 doses of measles vaccine, the first between 12 months and 15 months, and then the second before they enter school at the age 4 to 6. After the first dose, 95% of people are fully protected. After the second dose, that goes all the way up to 99%. Measles is probably the most contagious virus we know of, but this is also one of the best, most effective vaccines we have.
Wow. And also you wrote on Twitter, according to the CDC, 19 states allow parents to opt out for philosophical objections to vaccines, and that this is a problem. But Terry is asking, can't vaccinated people give the disease to each other anyway? Is the herd really affected by the small percentage of the unvaccinated people?
Yeah, I mean, actually, if you can only transmit this disease to somebody else if you are infected and you have the disease. So vaccinated people do not transmit the disease to others unless they are one of the 1% of people who get the infection and can spread it to others. I'm very concerned about these philosophical exemptions. What it basically says, I mean, when I was a kid, the only people who didn't get vaccinated were people who had a medical reason. Maybe they had cancer or some other reason that wouldn't allow them to get the vaccine. Or the few people who had a true religious exemption, where their religion prohibited getting vaccinated. Now with the philosophical objections, you can say, I just don't believe in vaccines. I don't want to give it to my child and not vaccinate your children. And so you're seeing some schools, some pockets where 20, 30, 40% of kids in the school are not fully vaccinated. And that doesn't just put that child at risk. They're putting children who decide they want to get vaccinated at risk because no vaccine is 100% protective. You count on everyone in the community doing the right thing.
It's so interesting that you should bring that up because we are about to hear from one mom who says she's a nurse, she did a lot of research, and she chose not to vaccinate her child. Let's first hear from her.
We don't know what the accumulation of the different contaminants in the vaccines are doing to our children, what it's doing to their DNA.
DNA, Dr. Besser, is that medically correct that we don't know what this is doing to our DNA?
Yeah, I mean, when you look at vaccines and what they do, they're not altering our DNA. They're stimulating our immune system. And our immune system is an amazing thing. All day, every day, whether you're getting a vaccine or not, we're being bombarded by things in the environment. We're being bombarded by different viruses and our body. We're having cells that are mutating, and our immune system's pulling those out. It's a fantastic thing. With a vaccine, you're giving something to stimulate your immune system to kill an infectious disease. Some are viruses, some are bacteria, but it's not altering in any way our DNA. I don't think that's something people need to worry about.
So then how do we explain this outbreak? I mean, would this have happened regardless whether people got vaccinated or not? I mean, how do we explain this?
Well, as long as there are diseases existing anywhere in the world, we're at risk. And so we eliminated measles from the United States in 2000. That meant that there were no cases just being transmitted in the U.S. But since that time, we continually have measles coming back from Americans who go overseas to travel and get infected and bring it back, and visitors who come here on a holiday or as students bring the infection in and it spreads to others. As long as our level of vaccination remains very, very high, you'll see small isolated cases, 2 or 3 cases when someone comes in with the disease. When the level drops really low, and for measles it has to be above like 95% coverage. If it drops below that, then you can see transmission. And last year there were 23 separate outbreaks of measles, 644 cases. That's the most cases of measles in the U.S. since 2000. And that worries me. It worries me because when you don't see a disease around, it's very easy as a parent to say, I don't want to give my child a shot. It's chemicals, it hurts, they're uncomfortable. Why should I do that? I've never seen measles. I've never seen polio. I've never seen whooping cough. It's very easy to say no. But when you say no, you see what's happening now is the disease comes back.
I was, on a parting note, I hate throwing out numbers because it just gets all confusing. But I feel like we talked about the Good Morning America statement that you gave, the fact as far as what can be done to prevent this, at least the spread of it, and the statistics that you shared.
Yeah.
That was fascinating.
Yeah, so this is the most contagious disease we know. It's one of the most effective vaccines. So if you've been vaccinated against measles and you're exposed to it, your chance of getting measles is 1%. If you're exposed to measles and you haven't been vaccinated, your chance of getting it is 90%. 90%. There's no infection that spreads with that fiercely, but this vaccine is very effective. My recommendation to people is just make sure you're vaccinated, and then you're not going to have to worry about this.
And you told me, I said I wasn't sure if I was vaccinated, and you said just go ask your doctor.
Yeah, they can do a simple blood test, measure your titers, and tell you whether you're protected.